Have you ever wondered how well your dental implants will work after 5, 10, 15 years in service? Well, let me share with you my experience dealing with implants in the last 20 years and what I found out that we can do to ensure the long-term survivability of your implants. How long will my implant last, or will my implant last forever? Well, it is legitimate questions that patients should ask their dentist. But also what patients should ask their dentist is what will happen to their prostheses and their implant reconstructions after 5, 10, and 15 years. Because things can happen, and really, if you think about it, nothing lasts forever. And what you should know, and we should have a conversations with your doctor, is what are the type of complications that you expect when you are dealing with complex or simple implant reconstruction. Because let's face it, not everyone is gonna have this great case with everything looks exactly the same when we start, or after 8 years, or when we'll look at 12 years in service. So each implant restoration is made out of 3 components: the implant body itself, the crown, and the piece that connect the crown and the implant. And something can happen in the long term to each one of them. So you can have bone loss around the implant, you can have porcelain fracture in the crown, you have an abutment failure, anything can happen to any one of them. If you're new to the channels and you like the content, hit the like button and subscribe to our channels. We see some catastrophic failure after sometimes, and what you'll see is some of the implant will completely destroyed and the bone around them completely gone after 15 years in service. This is require a completely new reconstruction. This is why I prefer to place the implant in the thickest bone and try to protect as much bone as possible, and stay away from surgery that require reducing the bone a lot, keeping in mind that you might have to go through another set of reconstructive procedure 20 years from now. So these are the things that you should ask your doctors. What also happens as the most common things in the long term is gum recession. So you have a nice bridge, but then when you smile, the metals start showing, and you will see this progress of bone loss happen in 5 and 10 years. To repair it, you have to change the bridge and go through the process one more time. But it is extremely important as a patient to know that this is what's going to happen in 10-15 years. So you will be prepared just in time for it to be replaced. So you don't feel surprised and you don't feel like something went wrong. And the way to change them may not be very complex, but it can be costly. And you have to know that before you go in and have the treatment done. And when you have some things that it is made out of acrylic, for example, like this case, which is one of my longest follow-up for a patient. I delivered this case in 2000 and it's 2024. So I'm looking at 24 years follow-up. The implants are solid, but the material that we build the prosthesis from, which is acrylic, tends to wear down faster than porcelain. So this is the second time that we change the acrylic, but we didn't have to change the implants and we didn't have to change any of the metal framework. And when you get acrylic teeth on your implant, you have to know that at one point you're gonna change those acrylic teeth with time because they will wear down. And remember what I was telling you, that if something happens to one piece of your full mouth rehab, you have to replace the whole thing. Our new thinking is try to break it down into multiple pieces. So if it happens to one, you don't have to change the whole bridge. So as you can see, we can segment the final bridges into multiple components. If something happens to one, it's not a catastrophic failure. It's 2 units that can be changed very quickly. One of the other common problems that you see in the long term is gaps between the teeth. Remember, implants will not move, your teeth will. So after 5 or 10 years, teeth will start shifting around and the implants will stay the same. So you will develop gaps, and that's normal. That's not a complication. It's just a normal occurrence when we're looking at the long term. And if you design the implant crown correctly, then you can unscrew it, add some composite or add some porcelain, and you can put it back in without the need to replace the porcelain crown. So treatment plan it better from the beginning with the right angulation and the right implants so you can avoid these kind of problem in the future. But sometimes people can't do that, and you'll see this is an implant that was placed on a young patient. Remember, implants will not move, teeth will. So with time, teeth will shift, they grow downward, and the implant will stay. So you'll see there will be a different level in the implants and the implant crown. So you should be prepared for something like this if you're getting your implant placed at a very young age, and you might have to remake your crown again. Another problems that we talked about is if the implant itself is fractured, where you can see part of the implant is broken and the whole segments will come out. That's a catastrophic failure because the whole implant needs to be removed and you need to start the project all over again. So the idea is trying to avoid these problems from happening by selecting a proper implant manufacturer known for their strength and durability, and then doing the right size implants for the right location. To be able to prepare for a 14 years and longer follow-up, it's extremely important to discuss all these different things with your dentist. We like to see this picture where we're looking at a 20 years follow-up, no bone loss, no gum recession, minimum complication, but again, it doesn't happen a lot, and that brings to a happy patient. For 20 years, I've known this young lady. Every time she comes in, she gets me this beautiful cookies, and my dog gets some cookies too. But the most important thing is we have 20 years of great friendship, and I can't believe how time flies. It does. So remember, nothing looks the same after 15 and 20 years, and things can happen, and it's very important to minimize those complications and to discuss the long term with your dentist. If you still have any questions, please don't hesitate to contact the office and request a complimentary examination. Thank you.